How to choose your facelift surgeon is a common question that patients ask me, and I've recorded this video of a series of points and suggestions to help you make the right decision for you. Facelift surgery, when conducted well, results in a natural rejuvenation, will improve the characteristics of your face, including the jawline, often your neck, facial characteristics of the cheek and the lower third of the face. And well performed well, the scars can be hidden in a way that they are difficult, if not invisible, to see. However, we've all seen celebrities, A-list celebrities who've had photographs of them taken after plastic surgery where their face looks overstretched, plastinated, very much a non-natural or fake-looking appearance. And so it is key when choosing your potential facelift surgeon that you do take some time and consideration, do necessary research to find the best surgeon for you. And so I'm going to give you a few suggestions to help you make that decision. Firstly, I would choose a facial cosmetic or facial plastic surgeon, or a surgeon who specializes in the face in order to do facelift surgery. Facelift surgery is very much a surgery of millimeters. Millimeters can make the difference, avoiding the key areas of the face where important nerves and innervation to the face is paramount of importance in facial surgery. Whereas, say, body surgery is surgery of centimeters. Breast surgery, body surgery does not have the same necessary finesse in terms of millimeters in order to achieve that result. So choosing a surgeon who specializes in the face, who's performing facelift surgery on a daily or weekly basis, is very important. Second characteristics is the natural artistry of the surgeon. Every surgeon will have a different degree of artistry and style. My personal preference is a very natural looking appearance where most people will just have a feeling that you look refreshed in a natural way and not be able to tell that you've had surgery. Other surgeons may have different techniques, and it's important that you look at before and after photographs to get an idea of how your potential surgeon is in terms of his results and the artistry in which he performs surgery. Another aspect is time. How long will your surgeon take to do your surgery? Facelift surgery is delicate surgery which takes time to complete. I can tell you when I complete the surgery, in order to give the finest scars, it can take me 45 minutes just to prevent visible scarring on one side of the face. And so it can take a great deal of time because of the meticulous technique. I would say that the minimum amount of time that a facelift procedure should take is 3 hours. And combined with other techniques, it may take well over that, 6, 7 or even more hours in terms of overall procedure. However, any surgery that is taking less than 3 hours is unlikely to have that level of detail required to give you a natural rejuvenation without any visible issues. Another aspect is speaking to past patients, past clients, and this is a more contemporary approach, but asking your potential surgeon whether you can speak to potential patients who've undergone the procedure with that surgeon is a way of getting reassurance that you're going to be taken well care of and get the result that you're looking for. Another aspect is choosing a surgeon who specializes in cosmetic surgery. Cosmetic surgery is very much an intricate surgery that requires attention to detail. Millimeters will make all the difference. This contrasts with reconstructive surgery, which is about repairing facial structures after tumors and trauma, where the same level of detail is not required because it's secondary to providing a functional recovery. So I would choose a surgeon who specializes in cosmetic surgery, who will have an array of techniques, different ways of doing a facelift. Not just mini-facelift techniques, but there are deep plane techniques that will give you a longer lasting result with faster recovery, and it's really a cosmetic surgeon who's going to be specializing in these particular techniques. The other aspect is revision surgery, and more than 20% of all the facial plastic surgery I perform is revision surgery on patients who've had surgery elsewhere. And commonly with facelift surgery, this may be revising scars or hiding scars where insufficient detail has been taken in the first case to provide the surgical result. So I would encourage you to ask your potential surgeon about revision surgery and what is their rate of revision, as you want to choose a surgeon who has a relatively low rate of revision surgery. In this day and age, we live in a very transparent era, and you can do a great deal of research, reading reviews, reports about your surgeon before going to the consultation. And I would encourage you to do that to give you an idea of how that surgeon cares for his patients and how his results match up. Also important is listening. And how do you feel during the consultation with that surgeon? It's important that you feel the surgeon listens to you, takes on board what you're looking to achieve, and there's a feeling that that surgeon is going to be there for you after the surgery. I personally see all my patients at every post-operative appointment because that's important to me and important to my patients. And other surgeons have different approaches, and it's important that you find a surgeon that has good communication and rapport with yourself. So overall, I would say it's important to take your time. Your face is important, facelift surgery is intricate. You need to do a necessary amount of research to find the best surgeon for you. I hope this information has been useful, and if it has, I'd be grateful if you could give me a thumbs up, and I look forward to recording more videos for you in the future. Thank you for watching.